The books that I brought, many books, paperbacks, dictionary, and I thought we'd use these today. Fatal sins. We'll talk about this again when we talk about medical jurisprudence and medical ethics. One of the key sins we want to avoid is failure to obtain informed consent. Remember, no matter what we're doing, anytime we intervene to treat, we need to ask patients permission to intervene and treat. We need to discuss with them potential risk, side effects, and benefits of the medications. We need to ask the patient to, in his or her own words, explain back to us what we have just told them, and then ask permission then to proceed. And that's obtaining informed consent. We also talked about, in this component of psychiatry, the 7 deadly sins. Remember the 7 defense mechanisms that Sigmund Freud detailed. And so I have the book Fatal Sins, written by David Steele, Danielle Steele's nephew, probably soon to become a TV miniseries. And what I'm going to do, if I may, is, and please, I will probably move along the center aisle. I hope that's okay. It's easier to access. So if I may I hand you both this book, and I'm going to ask you two as a team to tell us, please, how many pages there are in the book. You need not be psychic. You may turn to the last page.
280.
280. I'm going to ask you to allow me the poetic license to say 300. It makes the math easier. 300 pages. In a standard galley proof of a hardback book published in the United States, they're typically between 200 and 400 words per page. 300 pages, 400 words would be approximately 120,000 words. I'm going to ask you in a moment to open the book to any page you want. If you don't like that page, by gosh, go to a different page. It's okay. I want you to find the page with which you're comfortable. Once you've found that page, then I'm going to ask you, please, to silently scan down that page and find a word. Now, I'm going to ask you, please, for today's purposes, to select the biggest word, the longest word, the most letters, the most syllables. The reason being, that will make this the most impressive. If you find yourselves conflicted, an intrapsychic conflict between 2 of the biggest, longest words, you may select 2. Now, I don't want you to speak the words out loud. I just want you to look at the word or words, point to it for each other, remember the word or words, and then close the book. Okay, so I'm going to ask you now, please, to go through the book, and I'm going to ask you, please, to find a word or words that you just feel drawn to. And as our colleagues are doing that, I have other books, and so I am going to ask those of you, if it's okay, along the inner corridor, as long as you feel comfortable with your vision and you'd like to participate, if you'd just raise your hands, I'll come by, because as they're looking, very good. I'm going to ask you, please, to select any one of the books you want. Please hold on to that book a moment. Just place it onto the desk and hold on to it. And then, very good. I'll have you please select a book. Please just take that, hold on to it, set it down if you will, and then your hand was raised. Please hold on to the dictionary, and I will come back here. Death Wish. My hero, Charles Bronson, starred in that movie, and then there was a whole series of them, and I think the last one was Death Wish meets Rocky beneath the Planet of the Apes, something like that. However, Death Wish reminds us that when we are evaluating patients, we need to ask if they're having any suicidal ideations, because as you remember, 10 to 15% of patients with major depressive disorder will successfully suicide, and therefore shorten lifetime. 1 out of 2 patients with schizophrenia will attempt suicide at least once. 10 to 15% will succeed, and so too with bipolar disorder. Death Wish. I'm going to ask you, if you will, just to say stop anytime you want as I leaf through. Very good. Are you satisfied? Because I'm going to ask you to memorize the first word at the top of that page. Okay, very good. You've got that word. Please tuck it away. Keep it in your memory, and we'll come back to it momentarily. Okay? Others have books. Is that correct? You all selected 1 or 2 words. 1 word. I'll take the book back, okay? And I'm going to ask you, please, not to tell us your word, but I'm going to ask you, if you will, just to share with us out loud the first letter of your word.
H.
H. Hold on to that. I'm going to borrow back the book from y'all, and I'm going to ask you please to say stop at any time.
Stop.
Are you satisfied with this page? Because I'm having you memorize the first word at the top of that page.
Yes.
Very good. Okay. Does anyone else have a book? Ah, yes. I'm going to borrow your book, The Ultimate Flashback. We talked about post-traumatic stress disorder. Post-traumatic stress disorder, what are the hallmarks? We know the hallmarks are nightmares, revivifications, flashbacks, individuals having experienced a life-threatening or so perceived experience that then causes them a feeling of helplessness, horror, fear, and the individual then is easily irritable, wants to avoid talking about the situation. I'm going to ask you, please, just to say stop at any time as I riffle through the book. Stop. Very good. I'm going to have you please look at the first word at the top of this page. And then you selected at random 2 page numbers. Am I right? So I'm going to ask you, please, to look at those 2 page numbers, to turn to those 2 page numbers in your dictionary. Okay? So we've randomly selected pages that you turn to in the dictionary. We have a lot of words floating around. I'm going to ask you all selected a word at random. And the word you selected at random was one out of 120,000 words that you selected. The unconscious mind goes to a word that has meaning. Out of 120,000 words, you reminded us that when we're talking about mood disorders, all too often we see individuals who are suffering from decrease in mood, depression. When that happens, we see emotional response. Letter H doesn't tell us a whole lot, but it does tell us, little by little, if we get another piece of information, maybe an A, maybe an N. Individuals come into our office and they may actually be tearful and crying because of their depression, and we can see that. And the word you selected was handkerchief. Is that correct? Yes. And you selected a word at random, and the impression I'm getting, I think it was 3 letters. Is that right? It was a small word. And in the textbook, as a matter of fact, I actually write in here, there's a section in the appendix of words I seek to avoid, and the words I seek to avoid are, one of the words is, and this is the word you selected, and I really appreciate you selecting it, because it reminds us this word negates everything that comes before. So we don't want to use this word. And we say to our children when we're disciplining them or guiding them or directing them if they have ADHD, and we say, I love you, but I don't like it when you do this. We don't want to say that. We want to say, I love you, period. Our love is unconditional. And then we say, when this happens, not when you do this, when this happens, I feel this. And so we've taken away the you statements, we've stopped the negation of our love for our child, and now we're able to guide our child successfully. And when we do and behave appropriately, the word that you selected reminds me, you selected a 4-letter word, is that correct? And the word that you selected reminds us what we want to do is THIS, this. Is that right? Yes. And if we don't do that, then our children will feel crumpled. Is that right? Yeah. And 2 pages were selected at random. You turn to them in your dictionary. Is that right? And there should be 4 columns of defined words. 2 on each page. Is that correct? So we have columns 1, 2, 3, and 4. And I'm going to ask, what column would you like us to use? 1, 2, 3, or 4? 3. I'm going to ask you please to look at the top of column 3. First bold print defined word at the top of column 3. And as you focus on it, it reminds us to be very careful, very judicious, and ethical in our diagnosing. Because when we make a diagnosis for an individual, we've created now a prior existing condition. And we've created now a label that follows the patient for the rest of his or her life. So we want to be very careful. We want our diagnosis to be accurate and appropriate because we've created for our patient. Please let me know if this is accurate. The word you're thinking of and looking at is E-A-R-M-A-R-K. We've created an earmark for our patient. Is that correct? Thank you all very, very much. Thank you.